Good morning, everyone. I am Dr. Mallik. Last time I made a video. This is my second video. And last time, my first video, I will share you, please. What I am an anesthetist. I shared in my first video. I am an anesthetist and intensive care specialist. Basically, I crossed 60 recently, just about 6 months back. I crossed 60, now I am reaching 61. I crossed 60 years and now I am proceeding to 61. So, 3 years back during Corona time, I had metabolic syndrome. 2 years, it was an intense, 2 months in 1920 and 21 again 2 months. Almost 2 to 3 months, we intensively worked on Corona patients. Nearly daily we used to get not less than 50 to 60 patients. Used to put them on ventilators. So I didn't care myself. Probably that was, maybe I also got some Corona which is unnoticed. And previously also I had BP, diabetes, sugar and BP. But I was on medication and well controlled. My weight was only 80, 81 till that time. But during this 1 to 2 years, I picked nearly 16 kgs. 96 became my weight. And my BP was 170, 100 in spite of 4 tablets a day. And diabetes is uncontrolled. I was taking insulin 3 times a day for 1 week. And even thyroid, I became hypothyroid. I was using L-Troxin, almost 50 mg per day. But at that time, I rethought what to do. Then very strictly I followed a diet regimen and then exercise. It is 80% exercise and 20% diet always. As usual, everybody says that it is 80% exercise and 80% diet and 20% exercise that will give you the maximum benefit. That is the main, and exercise definitely is important. Maybe it is only 20%. So I wanted to demonstrate the exercises which I am doing regularly. I made a small home gym. It's a funny thing how this exercise came into my life. When I was an intermediate student in 1980, I had one colleague who is very strong, little tall. So he's my classmate, he's a benchmate. So we used to go back home after the college. So to a vegetable vendor we went. I was taking some brinjals. I asked him, he also took some other vegetable. So I asked the shop vendor, how much is the kg? He said, Chotu, this is 20 rupees kg. And my colleague, when he asked about some other vegetable, he said, sir, this is 25 rupees. I was stunned. Chotu to me and sir to him, same age. And from next day onwards, I started going to gym, and I went on to become Mr. College in 1983. 1983, I was Mr. College, Mr. Gandhi Medical College. Okay, leave it. So, metabolic syndrome, which I faced in 2021 after Corona, going to 96 kgs, high BP, uncontrolled sugar, etc., and breathlessness when you are climbing. I stay in 3rd floor. So I could resolve it completely. I could just return to normal within a period of 3 to 6 months. In fact, 1 month I got so many changes. Actually, metabolic syndrome nowadays is starting at the age of puberty, like 14, 15, 16 and up to 40 years of age. So what are all the things that happens in metabolic syndrome for females? Metabolic syndrome is manifesting as hypertension, BP, diabetes, obesity, PCOD. That means ovarian cysts have some small follicles, cystic things in ovaries, both the ovaries, okay? And hirsutism, see, unwanted hair on the face, etc. And infertility, definitely infertility has increased like anything. Every alternate couple is suffering from infertility. And males also, it affects males also, same thing. It affects males also in the same way. That is hypertension, diabetes and obesity. You see so many people having central obesity with big abdomen. And one more thing is they are also infertile. Infertility has gone beyond everything, it is because of metabolic syndrome. So what I want to tell you now is how food and exercise made my life. I mean, how I could return back, and the same thing I want to explain now. First of all, because it is 20% smaller thing, now first we will concentrate on exercise. And exercise not only reduces your metabolic syndrome, and along with food, 80% food and 20% exercise, and it releases endorphins, which keep you endorphins in the body, which keeps you happy throughout the day. So exercise is that important. I made a home gym, small home gym, over a period of time. See, not one day. Nearly about 25,000. I could have a home gym in my own bedroom, because I can't go out. I am an intensive care specialist. I can't move out of the hospital, and around the clock I am on work. Okay, just watch it. This is bench press, and I purchased it for 5,000 rupees. The basic bench press is around 2,500 on Amazon, and rest of that rod and weights I have purchased in the shop nearby. It's just 5,000 rupees when I have purchased 6 years back. Even now it is the same. So this is an excellent exercise for face, neck, shoulder, abdomen and back muscles. Don't please try to put heavy weights. Take small weights, little smaller than what you can do. Just 4 to 5 times in one set, about 4 or 5 sets depending on your convenience. So please start it slowly. I think if you already started, but one thing is, there is a bad habit in gyms of taking heavy weights and doing it once or twice with somebody's help behind. It doesn't help you, brother. It doesn't really help you. The thing is, take smaller weight, do number of times. That is the physiology of the muscle. So the more the muscle contracts, the more the muscle develops. Please, and don't see, if you take heavy weights, you are every chance of getting injured is there. Injuries are very, very dangerous. Sports injuries are very, very dangerous. Never land in sports injuries in exercise, particularly. See, exercise is to improve you, not to deteriorate you. Okay, so please take less weights. Don't be too much enthusiastic. This can be done daily or on alternate days according to your convenience. To this rod with small weights. See, once again, take small weights, do number of times. That's the only thing I will tell you. This is very, very useful. I have took it for 1,000 rupees only. It face muscles, neck muscles, abdomen, shoulder, back muscles, everything. It takes care of everything. 4 to 5 or whatever it is, how many in a set you can do any number of times, and please repeat the sets 3 or 4 times or 4 or 5 times according to your convenience. But a wonderful exercise which you can, within 1 month you can appreciate the changes in your body, and it is not the question of shape of the body or whatever it is. It is toughness. Why toughness? The thing is, as you are slowly aging, see, you are liable for small injuries and fractures. These are prevented by these exercises and building up the muscle mass. Next we'll come to push-ups. We call it dandalu. So, same thing. See, only thing is, this is a wonderful exercise for the total body, mainly the upper body. Lower body also gets good. I mean, lower body in the sense thighs and calf muscles. They also get sufficient exercise with this. But the main aim is same: face, neck, back, abdomen, and everything, leg muscles. Okay, same 4 to 5 sets, whatever it is. The main advantage with all these things is, as your abdomen and spinal muscles and back muscles are getting tightened, and shoulder and neck muscles are improving, you will avoid small things like cervical spondylosis, shoulder stiffness, etc. And one more thing is hernia, which is very, very common at the age of 60. Now I am 60 plus. I crossed 60. Now I am entering 61. I entered 61. Sorry. So there is a very chance of daily operate cases called hernia. Hernia means some part of the bowel or part of the bowel comes out of the abdomen. That is called in the left inguinal region or right inguinal region, this is called direct inguinal hernia, which is only because of the flabby abdominal muscles. This can be prevented by this particular exercise. Next we'll come to dumbbells. You know what the dumbbells is meant to. It is for your shoulder, your upper arm, forearm, and wrist. See, why you need to have this? Because if you have tough muscles and tough tendons, tendon is what is called a tendon. The muscle where the muscle arises from one joint and gets adherent to the other joint with the tendon, because the muscle ends in a tendon. The tendon is fixed to the bone. So if the tendons are tough, muscles are tough, you don't land up in small injuries even after a fall, or suppose you fall from a bike or anything, you don't get a fall, you don't get an injury or fracture so easily. So these are all the basic things. Next we'll come to finger exercises, brother. So the thing is, these finger exercises, wrist exercises are very, very, very important. Take me, see, in the forearm there are nearly 22 muscles. You will be surprised to know that in the upper arm there are only 3 or 4 muscles. But in the lower arm, in the forearm, you have 22 muscles. This is creation of the nature for our writing, special skills, etc., etc. So, wonderful exercise for your hand, wrist, etc., etc. Again, I said you can avoid trivial injuries. You can avoid fractures by trivial, small injuries. And one more thing is, there is something called writer's cramp. Writer's cramp. Some people develop, even me, I developed it. When you are writing, after a paragraph or two or three sentences, your hand, your forearm starts paining like anything, really painful. So after doing this particular exercise for about 1 month or 2 months, I lost it. Now I am able to write some pages also, absolutely no pain. Now come to sit-ups. As you all know, this is the best exercise, a very traditional exercise, and undoubtedly the best exercise for your knee joint, for your hip joint, as well as your everything, whatever is upper body, lower body. It doesn't mean your heart rate increases. Everything will be there. So this should be done at least on alternate days. Now come to the leg muscles. Mainly the calf muscles. This is an exercise mainly for the calf muscles. You know, calf muscles are the main muscles which pump the blood. That is the venous blood. The arterial blood comes from the heart to the periphery, to the body, whereas the venous blood, which is called impure blood, is taken from total body, even from the foot or anywhere, it is taken back to the heart for getting purified in the lungs. So pumping is by calf muscles. So by doing this exercise, your pumping increases, your heart function increases, and number 3, you can prevent varicose veins. Varicose veins is nothing but engorged veins, big veins you see in rickshaw pullers and chronic people who stand. That veins can be prevented. You can prevent so many other diseases also. Cycling is the best exercise after swimming, but in Indian conditions, I don't advise swimming because the pool maintenance is very bad. Swimming is not that comfortable in India. Maybe in other countries, I don't know. I have seen so many places in India. I felt this is not good to do in this particular pool. So please, swimming can be done. I leave it to you. Swimming is the best whole body exercise, they say. But number 2 is cycling. Cycling outside the home, that is on the roads, is not advised. I don't advise you in our conditions because we have been seeing regularly so many accidents. Please don't do it. You may be fresh in the morning and you are cycling, but the person who is driving from long distances like lorries, buses, etc., they are not fresh. They are driving from the night. So anytime any accident can take place and you may be, me or you may be a victim. Please don't do that. Please take a cycle like this. I have taken it 5,000 rupees. It was costing about 6 years back. Even now it is the same cost. Simply tighten and loosen and do it. Lastly, treadmill. Treadmill exercise you have taken it for 15,000 rupees online, but I have been doing it for the last 6 years. On and off, and the only advantage is going outside, walking on Indian conditions in our roads. You have to use very good footwear, and early morning I have been seeing people come to us going for walking, meeting with accidents. I have seen horrible accidents involve people who walk in the early hours. So, okay, good. Walking, if you are comfortable, if you think the roads are good in your place, please do it. And definitely walking is the best exercise. If you can't do it, please, you can do it home by treadmill. Very, very, very convenient. You can take a low, cheaper one also. I have taken only for 15,000 and using for the last 6 years. So this is a thing which I do. So these are all the exercises I do. If not daily, at least